Hello and welcome to Dragon Bytes, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bytes. This week we're going to continue our talk with Amarantha and Rosie about their interests in the field of sustainable healthcare. They were kind enough to chat to Stacey and Tom last week, and we're going to pick this up from where we left off. So if you haven't heard the first half of this episode, please go back to last week's episode and have a listen in. Anyway, let's get started.
So I wanted to move on a little bit to why this is important for paediatrics. So why is it so? You did mention about the school strike and things, and why is it particularly important in paediatrics?
So I think there's three main reasons. One is because this is going to determine children's health. Like, this is a massive health issue. Two, because children are asking us to make changes. We are the voice of pediatricians are supposed to be the voice of children and young people, or our colleges, and we should be trying to be the grown-ups in the conversation. I keep looking around. I still feel like I'm a child. I look around wondering who's going to be dealing with this massive issue and waiting for somebody to come in and be like, okay, it's all right, we're sorting it now. And then I suddenly realized, actually, no, I need to be part of that. I need to be the people engaging in this this conversation. And the third thing is that it will help bring about positive health changes for them. So one, it's going to impact their health negatively if we do nothing. Two, they want us to make changes. And three, the changes that we make will impact their health positively now rather than in the future.
Yeah, it's one of the reasons why paediatrics is so amazing. Hey, do you have any reasons why it's particularly important in paediatrics, Amarantha?
I mean, from a paediatric point of view, yes, they're my favourite group of patients to treat because they make no bones about what they want of us. They want something, they ask for it. And I think we're not only are we responsible for caring for them in a very particular way that means, yes, they get their appropriate treatment now, but we shouldn't be denying them great treatment in the future because of what we're doing now. And like Rosie said, they're very vocal about what they want, and I don't disagree with them at all. And it's my responsibility as a functioning adult to make sure I'm doing the best that I can for them. And yeah, and treating those patients in dentistry, I mean, is if you get the prevention right, they shouldn't need healthcare. It's a self-perpetuating system that has always baffled me, that the funding that we retrieve for healthcare is acting against us, because it means we don't have money for preventive schemes, because it's really hard to measure prevention working. And I think the whole system, when you take a step back and look at it, it starts and ends with the next people we're looking after, because otherwise what's the point? And it's a really big question, a really deep question to ask, and it's something I've struggled with in this position, because it's sometimes really hard talking about systemic change for these children, because we're so used to the way we do things. And I think it's really exciting when children come up to us and ask what we're doing and ask how we can do it better, because it flummoxes some of the people at the top, and that's really important and that's really powerful. So if we don't listen to these people, then yeah, what is the point? I'm not sure that's from a dentistry point of view, but from a paediatric point of view, when I listen to my patients, that's what they ask, and that's what I try and answer.
Yeah, that's great. I think time and time again, it's shown in loads of studies, isn't it, that the more that you invest in children and their health and their education, then it pays back for itself, many times fold in the future going forward. And that is the same for talking about their health and the changes we can make there. Are there some specific areas where paediatrics, from a sustainable healthcare point of view, can make some differences compared to other aspects of healthcare?
So what I encourage when I teach about sustainable quality improvement is for people to look at the carbon hotspots within their services. So each paediatrician will be acting within a different context. So some of us are community paediatricians, some of us are neonatologists. So, what you want to do first is try and study your system, map out where it is that you're having the most detrimental impact. And then think about focusing your changes to that area so that you get the most effect for the least effort. That's one of my mottos of life. But it would be great if I was to talk about acute pediatric services, I would imagine that the biggest carbon hotspot areas might be inhalers. And this is a particular topic for the National Health Service net zero target as well. So inhalers, for those who aren't familiar with the damaging effects of metered dose inhalers, these are the ones that you push down. They have a propellant inside, and we need those because that goes into the chamber, the spacer that we use, and then goes into children's lungs. So they're really a very effective way of getting a drug into the right space. But the problem is that the propellants that go into in gas chambers to make the drug come out, those propellants have a really high global warming potential. And the global warming potential is compared to carbon dioxide equivalent. And so if I was just to say a kind of one inhaler has like 28 to 40 times that of a unit of carbon dioxide. Now, if I was to put that in miles traveled in a car, so like a kind of salbutamol AccuHaler has about Atrovent, for example, would have about 250 miles of an equivalent car journey in a Ford car. So that's like quite a so when you're prescribing that drug, you don't think of that environmental footprint. And that's quite a high footprint compared to something like paracetamol, which would probably only have a very few number of miles traveled in a car. So it clearly is a resource that has quite a big environmental impact, and we should be trying to minimize that environmental impact by using that resource with the kind of stewardship that you would expect of something really expensive. So if the price of it was reflecting the environmental damage that it's doing, we would be possibly a little bit more cautious about how to use it and make sure that when we were using it, we were making sure that it was used most efficiently. That's not to say we shouldn't be using it. It's just saying how can we do that more effectively. And it might be a chance to talk about the sort of sustainability principles at this point. Would that be helpful?
Yeah, I think that'd be great.
So any resource that you might be thinking about that has a high carbon impact, you might want to apply these principles to. So prevention being the first and most effective principle that you could apply. So in terms of inhalers, could you prevent an inhaler being prescribed by improving somebody's kind of, either reducing their exposure to allergens? So is there a smoker in the house? Could you be helping them to stop? Are they living in an inner city area and having loads of exposure to air pollution? Could they be using different routes to reduce that? Should they be making sure that there's no dust mites in there? But, prevention of a respiratory illness is probably the biggest and most effective change, so that you wouldn't have to prescribe the inhaler in the first place. And then if you're not going to prevent, could you empower patients so that they know how to use their inhalers effectively? So we often find that patients don't know how to use an inhaler. They're not doing it properly. The parents are shaking it, then doing five sprays, and they're not counting properly. So always checking an inhaler technique and empowering the patients to use it effectively. And also, do they know where to dispose of their inhalers? So giving them information so that they know to dispose of it in a pharmacy and not just chuck it in the bin, because if they chuck it in the bin, the propellant leaks out that's remaining in the inhaler over a longer period of time, which has a higher global warming impact. So yeah, I can keep going. Would you? Yeah.
No, I was going to say definitely that last one. The disposal was the new one for me, and I completely didn't understand. I had a couple of inhalers in my drawer, which I just had got once when I was getting some wheeze with exercise basically, and then I just didn't realize that effect over time of just, it's the same as just using it completely, just by having it in your drawer. So and you know,
and several in your drawer is even worse. You're just leaving them all in your drawer. So bring them back to a pharmacy, put them in the pharmacy, and they're incinerated. When they're incinerated, the propellant is disposed of more effectively. It still has some global warming potential, but it's much reduced. So there was a scheme nationally run by GlaxoSmithKline that was to do with recycling those inhalers, and actually the propellant goes into refrigerators and air conditioning. So that propellant's really effective at trying to help gas exchange. So it's a really great thing, but there is massive amount of work to try to reduce those propellants in air conditioning units in the first place, because that is another carbon hotspot in our products because of their damaging effect. So yeah, go ahead.
Yeah, no, I was going to say, I suppose that's where the triple bottom line comes in again, is that, you know, previously I think we've all worked in places where a certain medication has changed purely due to its financial implications, and the, you know, pharmacy are prescribing a cheaper one. Whereas when you bring in the triple bottom line and other aspects, and we've got this other unit of value, then actually certain, you know, inhalers that have got, you know, half as much propellant in suddenly become more valuable. So we can make changes like that.
I think that at the moment that's the best that we can do, is trying to make those changes ourselves by trying to account the triple bottom line. At some point, possibly in the next 20 years, I imagine there will be a carbon tax to try to help us accelerate these changes, so that there is a financial impact that takes into account the environmental impact that's going on. And if you put a carbon tax on inhalers, you would see quite a quick shift, I imagine. So there is still very much, because of the economy that we live in and the way that we value products, the pound sign is the one that we understand, and that shifts behavior most quickly. You can see that in loads of other examples. When you put the smoking, the price of cigarettes up, the change was quite rapid. If you put that on alcohol units, you put it on sugar tax, you know, these changes can take place centrally. We don't have that yet, but in the absence of it, we could be trying to take that into account.
Great. And what about us as healthcare professionals, individuals? What can we do? I know we're just talking about procurement then, and pharmacy, but what can we do?
Yeah. So on an very individual basis, going back to the inhalers example, because I hadn't completely run out of my spiel on it, but if you want to shift your trust from prescribing what is called a low volume metered dose inhaler to a low volume metered dose inhaler, so the example being salbutamol to salamol, they're both MDIs, they both have the same amount of drug in, that would halve the amount of hydrofluorocarbons in that particular drug. So we're talking about a low carbon alternative medication. And if we wanted to have a very quick, easy win in reducing carbon emissions, that's like a change that can be made centrally within your hospital pharmacy. Contact your CCG, look at what they're doing to try to reduce their metered dose inhaler prescriptions overall, and also tell them about shifting from high to low volume inhalers. There you go. Really easy change. You don't have to give up meat, Tom.
I'm already giving it up.
Okay. What was my last point was leaner systems. So in terms of what else we can do as health professionals to try to reduce the carbon intensity of our health system, you can try to work more efficiently. So don't prescribe an inhaler if they've already got 3 inhalers. Don't give them another, like ask them if they've got their medication with them when they come in, and use that one rather than giving a new one out every time. So duplicate prescriptions and prescription waste is a major inefficiency in the NHS, both from financial and from an environmental point of view. So we should be looking at trying to build leaner systems in general. And that goes also into the way that we structure our health services and care for children. And I know that there's a major push to try to to increase primary care capacity to deal with a lot of paediatric issues, and therefore reducing kind of acute admissions and also what might be said as unnecessary attendances to the Paediatric Emergency Department Paediatric Assessment Unit. And there's some great initiatives that look at trying to empower and engage both primary care and patients to use the kind of primary care system appropriately. And that is a leaner pathway and would reduce the environmental impact of paediatric care.
Yeah, and speaking about the kind of inhalers and getting the basics right, I think do you think that's often one of the healthiest options? So a couple of times, if we actually were to look at the chamber that they're using, or like you're saying, their technique, we can see that the chamber's covered in, it's maybe not been cleaned as frequently as it should have, and it's just wasting all of that drug and propellant. And when it comes to almost anything that we do in pediatrics, when it's talking about children coming with constipation, if we actually really spend time going down to the root causes of it, whether that's having enough fluids, having a good diet, and actually getting into the nitty gritty, we can save on pharmaceutical interventions later down the line, and that's, I think, within all aspects of care, really. I don't know how you feel about it.
Yeah, so if you go back to the idea of prevention being your overarching principle, preventing children from becoming unwell, that's greater than treating them when they are unwell. So promoting healthier lifestyles within our population in general is the biggest probable change that you can help to reduce the intensity of the healthcare system. You're probably wondering why I'm not doing public health.
That's why paediatrics is so great, because we can do it all.
Yeah, exactly.
I just find everything's just so fascinating, and there's so much to talk about, isn't there? There's so many different bits that we can sort of expand on. But this is just one podcast, and maybe we could do one in the future, perhaps, if this one is okay. To sort of look at something in one aspect in a little bit more detail. But I was wondering, we've come up with quite a few resources during the podcast. But were there any other? I'm sure, hopefully, this has instilled some kind of enthusiasm amongst our listeners. Was there any more resources that you had that we could point people to if they wanted to find out more?
There are so many resources. There's just such a growth in this sector at the moment. I think people are finally really waking up to just how important an issue this is. So, of course, I can plug our own one, which is the Centre for Sustainable Healthcare website. We also have a particular website on doing QI projects in sustainability, and that's the susqi.org. susqi.org. There's also the Greener NHS website, which has got the plan for how the NHS in England hopes to reduce itself to net zero. There's the Royal College of Paediatrics are just about to release their plan for how they're going to support paediatricians and college members to become more sustainable in their practice, as well as what they can do for advocating for more reductions. And there's also a huge host of resources about talking about climate change. So that is a difficult conversation to bring up in your practice. So if you, as a paediatrician, if you're listening to this and you want to take away and maybe take this to your grand round, or maybe take this to your kind of departmental meeting, think about what you can do to become more sustainable, then maybe starting off by looking at some of the climate outreach resources on how to talk about this issue would be really helpful. So there you go. And Amarantha, any Wales specific things?
The first thing I'd say is not Wales specific, but Cardiff has become a member of Healthcare Without Harm, which is the NGO who figured out the mercury issue about 25, 30 years ago. And they're the ones who started it all off. And they have gained quite a bit more traction in the past sort of 10 years or so. So Healthcare Without Harm supports groups and organisations to become better with loads of resources. It's free to be a member. And they've just launched a doctors network as well. I'd also recommend looking at the Lancet Countdown and what the Lancet are tracking in terms of what's happening to health and climate change. And like I said, it can be really overwhelming when you're starting to look at all this stuff. The first thing I'd recommend is if you want to get involved in this, is find a support network, is asking questions of your health board. What are they doing to address the NHS England plan, the NHS Wales decarbonisation plan? How are they addressing all the key points? And starting to ask those questions does prick up the ears of the high level management and executive boards. And it's seeking out support systems like the UK Health Alliance on Climate Change. Health Declares has your health board or organisation declared a climate emergency. And then there are groups like Choosing Wisely and Wiser Healthcare, which look at reducing overdiagnosis and overtreatment, over-servicing, inefficient pathways, the value of that treatment and diagnosis pathway. So there are plenty out there, but I definitely start by saying it's not you yourself are not going to fix the problem. We ourselves are not individually fixing a problem. We are working together to fix these problems. And don't feel like you're alone in your efforts, because we're all working together, but being put in touch with people who are also doing it definitely helps. So don't feel like you are alone. Seek us out, find us on Twitter, follow all the feeds that are supporting all these efforts and forging all these links, because that's the only way we're ever going to fix this, is by working as a
thanks
team.
for providing us with at least a few days worth of information to look at there. What I'd quite like to maybe finish with just going into something that maybe a project or that you're particularly passionate about at the moment, or you're really excited about. I know Amarantha, we've been speaking a little bit offline about,
You're looking so excited there.
about Entonox and about nitric oxide, but maybe you could go into something that you're just really excited about within the space at the moment. You can talk about Entonox.
Okay, I can talk about Entonox. Okay, great. This always feels a bit taboo, really. So this drug that we've had for 200 years, that ironically was discovered by a dentist, is something that we've had and we've pretty much taken for granted. But I'm involved in a project called the Nitrous Oxide Project, which looks at the provision of it. It looks at how much you start off with in your system and how much actually reaches patients. And we're discovering that at least 80% of the Entonox and nitrous oxide we're using is just being vented into the atmosphere as waste. We don't actually know where it's going. And nitrous oxide is one of those key 6 gases mentioned back in the Paris Agreement, Rosie said at the very beginning. So we have signed up to reduce those emissions, and yet no one's counting where it's going. No one's accounting for it. So if you have piped nitrous oxide in your hospital, if you plug into the wall and give your patients Entonox, Google the Nitrous Oxide Project, because I guarantee you'll be kind of shocked by what we're finding out, and you can get involved as well. So I'm really excited about that, because you can just crush a carbon footprint, huge carbon footprint, and it's just so easy by turning off a tap that you're not using well.
And just remind us how many,
crazy.
what was the kind of comparison to CO2 regarding to?
Okay, so if Cardiff and Vale are wasting 80% of their Entonox and nitrous oxide supplies, it's about 20,000 tonnes in the last 3 financial years, and each one of those tonnes requires 7 fully mature trees to mitigate. So 7 times 20,000 tonnes is what we need to grow to mitigate the damage of just 3 years of waste that we didn't even use, that never even made it to patients.
Wow. And yeah, because Rosie mentioned earlier, that some of the inhalers were some like 15 to 20 times, worse than the propellants than carbon dioxide. What's the nitric oxides kind of comparison in that?
Nitrous oxide.
Yeah. Nitrous oxide, yeah.
What's the comparison to inhalers?
To a ton of carbon dioxide.
So, for example, a lady on Entonox during birth, it's about 60 kilograms for an hour's worth of Entonox, bearing in mind she could be in labour for about 12 hours. So already in that 1 hour of Entonox usage, 60 kilograms of carbon dioxide equivalents, she's shot any usage of reusable nappies, any usage. But that's the question that we're asking, and it's such a culturally sensitive issue, because it's something that we've used for 200 years, that you can start making these comparisons and as to what they're going later on. But without asking these hard questions, no one will give you the easy answers. So I can't give you the easy answers at the moment.
So Tom, I think what you're touching on is something called carbon literacy. And I don't think that there's a huge amount of carbon literacy available to us in the general public. There's huge numbers batted around. They don't really mean much to us. And I would recommend this book called How Bad is a Banana by Mike Berners-Lee, which is a great kind of introduction to carbon literacy. And also, like, I think converting it to terms that we understand can be really helpful. And then trying to find out where strategically we should make changes. So individually we can do stuff, great, but our carbon dioxide amount of per person in the UK, if you start making changes, you might knock off a couple of tons. Like, I probably live about a 5 to 8 ton lifestyle, depending if I fly or not. But I could do better. But at what point do I stop saying, like, okay, I'm going to take all this self-guilt and try and be a vegan who doesn't go anywhere apart from on my bike and, eats only local food. But actually, I could make a far greater impact on carbon emissions if I change systematic things and I influence at a higher level. So it's not about guilt. It shouldn't be all about guilting people into change. It should be about empowering people to see the positives.
Wow, I think that's a lovely sort of thing to end on, really. It's empowering, and that's lovely for me as I'm kind of starting on this journey.
Yeah, I mean, so many people feel guilty they don't even have children. They won't have kids because they're like, oh my gosh, what is the future going to hold for them? And I can understand this kind of dilemma, but actually we should be taking that feeling and make that outrage into optimism. Come and make a better future. Do it because we can. We know that climate change is bad for health. There's things that we can do now as health professionals to promote healthier lifestyles, which will reduce carbon emissions and have a positive impact on our health system overall.
And I suppose what I'm getting from you guys as well is that Amarantha mentioned it earlier. It's not just about being an activist and being an eco-warrior. If we're in the business, which we are, of providing healthcare, and especially to children who are going to be, there for the future, then we need to make sure we're doing the best to make sure that we're doing the best.
They have a future
for the future. And so actually,
I know.
Yeah, it's actually in our job description as doctors and healthcare practice. Yeah, so that's what I'm getting from.
It's overwhelming sometimes. I'm in a NICU and I'm looking around and I'm thinking, gosh, we're doing an incredible thing at giving these children the best options for a life, but actually at what cost? And should we really be using the resources that we are so inefficiently? I'm not saying we shouldn't be doing this. I clearly believe that child health is so important and that we should be promoting it, but we should be careful about how to do it in the most responsible way possible.
And I just wanted to say thank you once again to Amarantha and Rosie for taking time out of their busy schedules to come and talk to us about sustainable healthcare. I've certainly learned a lot listening to this podcast, and I hope this has been of a lot of use to many of our listeners also. That's all for this week. Thank you for listening to Dragon Bytes.